We want to welcome you to the BayCare Spine Program. If you were provided a Your Guide to Spine Surgery book, you may follow along with this presentation. A copy of this book is also available on the spineclass.org website. We are pleased you have chosen our facility for your spine surgery. Our goal is to return you to the best health as soon as possible. There's a lot to think about before surgery, and today we're going to provide you with information to help you become familiar with the process involved with your surgery and hospitalization. Learning as much as possible will help you play a more active role in your recovery. If you turn to page 5 in your book, you will meet the rest of your spine team. As you can see, there will be many people involved in your care, including a registered nurse, a licensed practical nurse, a patient care tech, or PCT. The PCT is responsible for taking your vital signs and assisting you with activities such as bathing or toileting. Members of your team may also include a physical therapist, occupational therapist, and hospital care coordinators. Some housekeeping updates. BayCare hospitals are promoting a healthy lifestyle. Please, no smoking on campus. If you smoke, you may want to consider stopping prior to surgery. If you feel you will need a nicotine patch for your stay, please notify your surgeon. Due to COVID-19, our facility's visiting hours are frequently changing to ensure the safety of our patients' families, and our staff. Please call your hospital for the most up-to-date visiting policy. Your spine is one of the most important parts of your body. It gives your body structure and support. It allows you to move about freely and to bend with flexibility. The spine is also designed to protect your spinal cord. The spinal cord is a column of nerves that connects your brain to the rest of your body, allowing you to control your movements. Without a spinal cord, you could not move any part of your body and your organs could not function. The spine is made of 24 bones called vertebrae. Ligaments and muscles connect these bones together to form the spinal column. The spinal column holds and protects the spinal cord, which is a bundle of nerves that send signals to other parts of the body. The many muscles that connect to the spine help support the upright posture of the spine and move the spine. The cervical spine is made up of the first 7 vertebrae in the spine. It starts just below the skull and ends just above the thoracic spine. The thoracic spine is made of the middle 12 vertebrae. The lowest part of the spine is called the lumbar spine. The area usually has 5 vertebrae. However, sometimes people are born with the 6th vertebrae in the lumbar region. The base of your spine, called the sacrum, is a group of specialized vertebrae that connect the spine to the pelvis. Let's take a closer look at the important structures of the spine. The vertebrae is the bony segment of the spine. In between the vertebrae is the disc. It consists of an annulus and a nucleus. The annulus is the tough, fibrous covering, and the nucleus is the soft, jelly-like substance in the center of the annulus. The foramina is the opening between the vertebrae, where the nerves exit. There are many different conditions or problems that can occur in the spine. Regardless of the type of condition, most patients experience pain or difficulty performing basic daily activities in life, such as walking, sitting, or sleeping. There are many types of surgical procedures used to correct or repair problems that you may have with your spine. It is important that you are well informed about your surgery. Each surgery is different, and your surgeon will determine the best surgical technique based upon your condition. Page 10 and 11 discusses the many types of spine surgeries. Surgical procedures cannot take place without first taking a good look at your overall health. Your surgeon or primary care physician will perform a pre-op physical to ensure that you are healthy enough to undergo your spine surgery. If you have any cardiac history, you may also be asked to see your cardiologist prior to surgery for surgical clearance. You may be instructed to stop taking certain vitamins or medications prior to surgery. Some common medications that need to be stopped prior to surgery include ibuprofen, Aleve, Advil, aspirin, and Motrin. These medications need to be stopped 7 to 10 days prior to surgery. Tylenol is fine to take up until the day of surgery. If you take a prescribed blood thinner like Coumadin, Pradaxa, Plavix, or Xarelto, you will receive special instructions on when this medication needs to be stopped and when it's safe to resume. The day of surgery, do not apply any lotions, creams, deodorants, or makeup. The day before surgery, you will be instructed to have nothing to eat or drink after midnight except for the carb-loading drink, if given. The carb-loading drink does not apply to all patients. Please note that surgery can be delayed if you do not follow these instructions. If you are told to take certain medications the day of surgery, take with just a small sip of water. Healthcare benefits are constantly changing. It is important for you to understand your benefits before undergoing surgery. Call your insurance provider to find out exactly what your plan does and does not cover. Be sure to report any changes in your physical condition to your physician. A number of problems may require the postponement of your surgery. These include a sore throat, a cold, a fever, dental problems, difficulty with urination, skin conditions such as rashes or abrasions. If you have any question whether you are healthy enough to undergo surgery, please ask a member of your healthcare team. Advance directives are forms that detail your choices for healthcare and treatment, should you be unable to talk to your doctor or make your own healthcare decisions. While there are other types of healthcare planning forms, the two main types of advance directives are designations of healthcare surrogate and living will. For more information and available forms, you can visit baycare.org/advance directives. Be sure to bring your complete advance directive form with you when you come to the hospital for your surgery. Page 18 in the spine book has a checklist of ideas to prepare your home for your return after surgery. It is important to pick up throw rugs before surgery. Rugs can become a tripping hazard. It may also be helpful to move frequently used items to the waist level. Grocery shop and prepare meals ahead of time. You can look through the checklist for other suggestions. What to bring to the hospital. The hospital is not responsible for any lost or stolen items, so bring as few items as possible. The hospital does provide toiletries such as a toothbrush, toothpaste, lotion, etc. If you have sleep apnea and use a CPAP machine, it is important to bring your CPAP machine the day of surgery. It will be used in the post-anesthesia care unit and on the medical surgical unit after surgery. We provide you with a hospital gown to wear during your hospital stay, but some people prefer to wear their own clothing. If you would like to bring clothing from home, make sure you bring clothing that is loose-fitting and comfortable. The hospital does have free Wi-Fi available, so if you would like to bring an electronic device, such as a laptop or iPad, you may. Please leave all jewelry and valuables at home. Please do not bring any medications from home unless you have been told we do not carry certain medications that you take. During your hospital stay, the nurse will be providing you with your home medications from our inpatient pharmacy. In the next few slides, we will review the steps leading to surgery and your recovery. Keeping you safe is our top priority. We will regularly ask you to identify yourself by stating your name and date of birth and comparing it to your identification wristband. The wristband contains a barcode that will be scanned for medications and procedures. This is an additional safety net that ensures we are providing the right treatment, tests, and medications to the correct patient. One of our goals is to prevent the spread of infection. Your healthcare team will be washing their hands with soap and water or using the alcohol gel before and after each patient encounter. If you have concerns that your healthcare provider has not washed his or her hands, please speak up and ask them to do so. We want to perform the right procedure on the right patient at the correct site every time. We will ask you to be involved with this process by identifying your surgical site and confirming that site with your surgeon. You will be given instructions on where to report the day of surgery. When you arrive to the pre-surgical unit, the nurse will ask your name and date of birth and place a white hospital band around your wrist. The band contains your name, admission date, birth date, and barcode, as mentioned prior. If you are allergic to any food or medications, a red wristband will be applied to your wrist. Since you will be receiving anesthesia and pain medications, you will be considered a high fall risk. A yellow armband will be placed on your wrist to identify you as a fall risk. We ask that you call for assistance every time you need to get up from a chair, a toilet, or out of bed. A fall could be detrimental to your recovery. Our motto is call, don't fall. While you are in the pre-surgical unit, the staff will be monitoring your vital signs, including your temperature, heart rate, blood pressure, respiration rate, and pain level. Your chart will be reviewed, and any additional testing that needs to be done prior to surgery will take place. You will also be connected to a heart monitor and oxygen. An intravenous line will be started, and you will receive fluids and medications through this line. You will also meet a few more members of your spine team. You will meet your anesthesiologist. an anesthesiologist or a certified registered nurse anesthetist will speak to you regarding your overall health and medical condition to determine which type of anesthesia is best for you. Anesthesia is a type of medication that causes you to lose sensation, therefore you'll feel no pain after anesthesia is administered. After speaking with anesthesia, you will be required to sign a consent form before moving into surgery. Your surgeon may order NeuroMonitoring for your surgical procedure. However, not all procedures require NeuroMonitoring. NeuroMonitoring is a process performed by a specialist called a neurophysiologist. Electrodes are placed on the scalp, arms, and legs. The neurophysiologist reads and documents your nerve signals during surgery and communicates these with your surgeon. If this device is used during your procedure, the neurophysiologist will meet with you in the preoperative holding room to discuss the procedure and have you sign consent. After surgery, you may find a piece of tape on your arm, behind your knees, or a spot that looks like a pinprick. After surgery, you will recover in the post-anesthesia care unit until you are awake and stable. Your nurse will frequently assess your dressing, vital signs, and symptoms. Our goal is to decrease your pain. If you are having pain, please let the nurse know so he or she can provide you with pain medications. When you are fully awake and medically stable, you would be transferred to the inpatient unit unless you are discharged home the same day. Upon arrival to the inpatient unit, the nurse will assess and monitor your progress throughout your stay. You will continue to have an IV and be encouraged to drink fluids. The IV fluids will be discontinued when you are able to drink enough. You may have a catheter in your bladder, which is to monitor your urine. Typically, this is removed the morning after surgery. Sometimes a drain is placed in the surgical wound after surgery to drain any excess fluids. This will be removed when there is decreased drainage. After surgery, you will be given small sips of water and a few ice chips. Depending on your type of surgery, your surgeon may want you to pass flatus prior to advancing to a regular diet. Once you can tolerate clear fluids without nausea or vomiting, you may begin to eat solid foods. If you are having neck surgery, you may have some difficulty swallowing. We recommend ordering soft foods for the first few days. Cold foods can also be comforting. Regardless of the type of surgery, it is important to choose foods that are high in protein and carbohydrates to promote the healing process. Postoperatively, you will be prone to constipation. The first way to prevent constipation is to eat a high-fiber diet and drink at least 6 8-ounce glasses of water each day. This is a picture of a healthy plate. My plate illustrates the 5 food groups that are the building blocks for a healthy diet using a familiar image. Nutrients can be found in many sources and can contribute to a speedy recovery. Be sure to choose foods high in protein, zinc, fluids, calcium, iron, vitamin A, and vitamin C. After surgery, your body is in a weakened state and at risk for certain complications. You will be instructed on techniques that help reduce the risks of these complications. In order to prevent pneumonia, you will be encouraged to take frequent deep breaths and use the incentive spirometer. An incentive spirometer is a medical device used by patients to help improve lung function after surgery and prevent pneumonia. It assists in lung expansion. Expanded lungs are healthy lungs. This slide demonstrates how to use the incentive spirometer. Begin by exhaling completely. Close your lips tightly around the mouthpiece. Inhale slowly and deeply, keeping the small blue ball between the 2 arrows. When you can't inhale anymore, hold your breath for 6 seconds. Exhale slowly. Do this 10 times every hour while awake. After surgery, you are also at risk for developing blood clots. In order to prevent this, we encourage early ambulation, frequent ankle pumps, and apply sequential compression devices while in bed. The sequential compression devices, or SCDs, are a device that lower your risk for blood clots. The SCDs are wraps that are placed on your legs with Velcro. These wraps alternate and gently squeeze your legs, helping circulate your blood, therefore reducing the risk of blood clots and pulmonary embolisms, or blood clots in your lung. Pain is a natural part of surgery and is something to be expected. Our team understands that treating pain is an important part of your care and recovery, and we are committed to managing each patient's pain. Only you can describe the type and degree of pain you are experiencing after surgery. In order to keep you comfortable, our team will be asking you to describe and rate your pain frequently. As a patient, we expect that you will assist your healthcare professional in assessing your pain. Your nurse will ask you to rate your pain on a 0 to 10 scale, 0 being no pain and 10 being the worst pain, a medical emergency. To help us measure your pain, we will ask you to rate your pain before and after each dose of pain medication. The pain caused by surgery may be severe at first, but it will ease as your body heals. Be sure to report any pain to your doctor or nurse. All surgical pain may not be taken away, but you can expect to be made comfortable. Comfortable means about a 4 on a pain scale of 0 to 10. There are different methods in which we give medications to treat your pain. We currently use a multimodal approach to pain management to reduce opioid consumption. Multimodal pain management includes the use of multiple medications and techniques, including opioid, non-opioid, and non-pharmacological therapies to control pain. IV Dilaudid, morphine, and fentanyl are the most common pain medications used immediately after surgery. We will start you on oral medications as soon as you are able. Muscle relaxants also work well in conjunction with your pain medications and may be ordered by your surgeon. The most common side effects for narcotics are the following: decreased respirations, drowsiness, nausea, vomiting, dizziness, constipation, rash, itching, dry mouth, and decreased appetite. Please report any of these to your nurse. Also, refer to the medication side effect sheet in your spine book on page 30 and 31. Out of the listed side effects, constipation seems to be the most common and can be a serious problem for some people. In order to prevent this side effect, you will be given a daily stool softener during your hospitalization. It is important to maintain your fluid intake to help the stool softeners work effectively. We also advise that you continue to take stool softeners following your discharge. You can buy these over the counter. Continue to take these stool softeners until you are weaned off the narcotics. While medications may help control some of your pain, there are other methods you will find helpful to assist in making you more relaxed and comfortable. These include ice, exercise, music, pet therapy, and distraction. See page 27 for other pain management treatments. To provide you with the best outcome, we have developed a care plan for your specific surgery. These care plans can be found in your spine book. Page 36 and 37 review neck surgery, and page 38 and 39 review back surgery. This picture shows a variety of cervical and lumbar braces that may be ordered by your surgeon. Not all procedures require a brace after surgery. Your physician will decide if a brace is required and which of the following brace you need based on your specific case. You will be educated on proper use of the brace, including when to wear the brace and the length of time the brace is to be worn. If your surgeon gives you a brace prior to surgery, please bring it to the hospital with you. Proper body mechanics are important, especially after spine surgery. After surgery, you will commonly hear no BLTs. This means do not bend at the waist. Do bend at the knees. Do not lift objects heavier than a gallon of milk or 7 to 10 pounds. And do not twist your trunk. The only aerobic exercise prescribed by your surgeon immediately after surgery is walking. Page 41 talks about good body mechanics. Your therapy team and your nursing staff will continue to educate you on proper spine precautions throughout your stay. Our team will work with you on a discharge plan that is safe and meets your post-surgical needs. A physical therapist will evaluate you after surgery and suggest a safe discharge plan that is based on your needs. The recommendations the therapist provides helps the surgeons determine the safest discharge plan for you. Physical therapy is going to focus on post-op exercises, ambulation, transfers, and performing stairs. Physical therapy may start on the same day you have surgery. Your physician may also order occupational therapy post-operatively to help you perform activities of daily living like dressing, bathing, and using the toilet while maintaining spine precautions. To ensure a safe recovery, you may need assistive equipment. This may include a reacher or a grabber that will allow you to access items stored above or below waist level, a walking aid, which can be a cane or a walker, a bedside commode. This is a raised toilet seat that is enclosed in an aluminum stand. It can be used in any room or placed over your bathroom toilet. It gives you the extra lift, which can be helpful after surgery. Remember, you don't want to sit on anything too low. Your spine team will help you determine which equipment is best for you. If needed, your physician will place an order for an assistive device, and the hospital staff will be sure the equipment is delivered to you. If you already have a walker at home, you do not need to bring it to the hospital. Each hospital room is equipped with a rolling walker. Please hold on to your durable medical equipment for at least 5 years. Medicare will only pay for a walker or assistive device once every 5 years. Our goal is to have a safe discharge plan. Planning for discharge is an important part of recovery, and we will work with you and your family to develop a plan that is appropriate for you. Most patients will be discharged home independently. However, home health care may be recommended for patients that need help beyond what a family or friend can provide. Home health care workers can bridge the gap by providing resources like physical therapy, occupational therapy, home health aides, and nurses. Home health workers help you walk, regain strength, and complete daily living tasks. They also monitor your condition and safety. Some patients need more help than home health care can provide. These patients may need inpatient rehab or skilled nursing care. In a skilled nursing or rehab center, you can continue your rehabilitation before returning home. Inpatient rehab therapy helps you build strength and endurance with a goal of returning home as soon as possible. There are a number of places to choose from for skilled nursing and rehab. If needed, our social worker and case coordinators will discuss options with you. When will you be discharged? A smooth and speedy recovery depends on you following the activities laid out by the healthcare professionals in your patient care plan. By strictly following this plan, you will have a better chance of leaving the hospital sooner for home or, if needed, a rehabilitation center. The type of procedure will determine your length of stay. Some patients go home the same day, and others may need a longer stay. Your surgeon or nurse navigator will review this with you. Goals to be met prior to discharge include up and walking around safely, eating without nausea or vomiting, pain controlled with oral pain medications, and having no difficulties urinating. Continuing infection prevention when you return home is important for your recovery. Some patients may have a simple dressing change. Be sure to wash your hands before and after caring for your surgical wound. Remember, do not apply lotions, creams, or ointments to your incision site. Be sure to use clean towels and washcloths with each shower. Change bed linens frequently. Do not allow animals to sleep in your bed, and wash your hands after touching animals. Do not pick or touch your incision. If you experience redness, pain, or drainage at the surgery site or develop a fever, call your surgeon immediately. Patients who smoke are at an increased risk of infection. Ask your doctor how you can quit. Diabetic patients with poor glucose control are also at an increased risk of infection. Be sure to follow your glucose levels closely. You will have access to the patient portal if you have provided the hospital with your email address. You will receive a link sent by the hospital. Please click on the link and you will be able to access your medical records. We always want to provide our patients with high-quality care. Please take a brief moment to fill out the hospital survey that may be mailed to you after surgery. To assist you in your plan of care, remember to bring your spine surgery book with you to the hospital. The spine program staff wish you a safe and rapid recovery.